Every day, many of you live with neck and back pain, and you simply don't have to.
That kind of pain can put a stop to so many everyday activities, but there's relief out there for you.
Dr. Christopher Miller is our expert on woodtv.com for treating back and neck pain.
And he's got an upcoming free workshop and is here to talk about it with us today. Welcome, it's great to have you here.
Well, thanks for having me back. We did one of these workshops a couple months ago, and it was stormy out, and I think tornado warnings, and we were still packed, so we're holding another workshop dinner next Tuesday night.
I think that just goes to show of how many people are in extreme pain that are looking for answers, because you get a lot of people that actually call you with a lot of different things. Your system and what you have set up is able to treat a lot.
Correct. What this workshop dinner is for is maybe people that have just given up hope, or they don't think there's any other options for them to get pain relief, or even just people that may have hurt themselves over the summer and just frustrated with their treatment options that they're being offered and are looking for something a little bit different. So what we're going to try and do is teach people what these different conditions are all about and why they're hurting, and then possible treatment options to get those issues resolved.
What are some of the things that you find people coming in complaining about that you're kind of working with?
It's a lot of chronic conditions, degenerative disc disease. We help people with herniated or bulging discs or ruptured discs, symptoms like sciatica, which is leg pain shooting down the leg, or even arm pain. Sometimes they've been told they have arthritis in their spine, and generally there's a little more going on than just that. We can help with those issues. So just, not just necessarily acute injuries, they hurt themselves over the weekend, but people that have been suffering for years and years, maybe they've even been through surgery and it's failed, and they just don't want injections anymore, or keeping up with the medications they're getting tired of.
So this is all non-invasive, no medications, just physical treatment?
Correct. Like I told you earlier, these are people that are tired of just masking symptoms, and we don't get involved with drugs or surgery. We're trying to really correct the cause of these pains and get that fixed so that they can feel better and have a more productive life.
Dr. Miller, I just have to think back to the last time you were in our studios. You brought 2 patients with you. You said, because I know that you've explained it, but there's nothing more telling than having people that you've treated in the studio. And one of them had a sports injury, and another woman, I believe, was about to undergo some major therapy for diagnosis that she had got MS, which she didn't even have it.
Yeah.
Is that really common that you see things like that? Because that blows me away.
Quite a bit. I mean, people come in and I tell them the first thing we got to do is figure out what the actual problem is. And many of them have already had MRIs or spoken with surgeons or other physicians. And, sometimes the MRI reports aren't even correct. We look at the images and see these issues going on that aren't even listed on the report. So that's something that we really spend a lot of time on, is discussing what they've been through and what's helped or not helped. And, just researching to find out what the exact problem is, so then we can give them good treatment options that are effective.
Yeah. Okay, so the seminar, tell us about that.
Okay, so this is going to be next Tuesday night. It's going to be held at the Kentwood Public Library, and again, we're going to just try and teach people about what these problems are all about, possible treatment options, and I'll touch on a couple unique options that we have in our office. One is called true non-surgical spinal decompression using the DRX 9000 machine, and another is Spine Force, which is 3D rehab, a fun way to exercise and get your body in better shape. But it's limited to 40 seats, and we can only fit so many people in there.
Right,
so.
I know, because you want to give people the attention and have those questions answered. And even so, on that note, you've asked people that if they have questions, they should send them in or email them to you, so you can make sure you can address them, in addition to getting your spot reserved for that.
Yeah, exactly. So they can go to our Facebook page or just email us, and I think that should be listed on the screen there.
Yeah, we had that up.
And so if they want to submit questions ahead of time, I'll make sure to address those there. But we're also going to do a little Q&A there, and if something pops up as we're discussing things, they can ask, and I'll do my best to answer
that's
that.
really great, because so many times you go to something and you're like, oh, I had a question, and you don't remember it. But if you're thinking about it and this is something you've always wanted to know, you can send it ahead of time. That's great. And I know if people call and it's a busy to keep calling, right?
Yeah, I think we have 3 phone lines, so they get pretty slammed, and just, if it's busy, just wait a few minutes and call back, because I have staff there to answer throughout the morning, and it's going to get booked today, so just make sure you call and get that scheduled, and we'll be ready to go next Tuesday.
Yeah, you're able to do some of this care. You had mentioned some of the technology that you're using, the DRX 9000 and the Spine Force. Those are machines that other doctors in the area do not use, and that your patients have found especially helpful.
Effective, and it's just quite a comfortable way to get relief. It's not invasive or real aggressive that causes pain, and they enjoy doing those things. And I've had people that just hate working out or exercising, and they're really challenged by that Spine Force. They're kind of working against the machine or being challenged by the machine, and it's a fun way to exercise. So
just the name.
We try to have fun too.
Yeah, it sounds great, doesn't it? I'm going to work on the Spine Force. It just sounds like
all with the goal of good health. Thank you so much for coming in today. We really
Thanks for having me again.
Okay, thank you.
Yep. Call as soon as you can. We'll be right back.